Intimacy is an important aspect of life, but for some people, it can be a taboo topic and difficult to talk about. Peritoneal dialysis can affect how some people feel about their sexuality and can affect intimate interactions. Sexuality and intimacy are broad subjects that can have very different meanings for different people. Intimacy does not just mean intercourse. Some general themes include intimacy and connections. This can include spiritual, mental, and physical connection with others, sexual desire, and libido. It is normal to have many different emotions and thoughts while experiencing health changes. It's important that you find what you and your partner are both comfortable doing and what is meaningful to each person. This may take some time and communication. Some people may access sexual health counseling for more support. You don't have to talk to anyone about what you learn here, but we hope that when you're done, you'll want to share your questions or concerns with your healthcare team and your partner. Common worries people may have could be, will the catheter be visible? Will I damage the catheter or hurt myself? Will I be desirable? Will I feel too full to be intimate? Talk to your loved one about it. They may not be as bothered by it as you think. Talking to other people on PD about how they deal with it may be helpful. Talk to your PD team for support or tips, some of which will be discussed later in this video.
We've always been very intimate with each other, but it didn't change. Just because I got a tube, PD wouldn't hold us back.
I avoided being intimate because I felt like I had a big belly full of liquid, and certain positions were awkward because of my catheter.
Fatigue can have a significant impact on sexual activity. Reasons you may have fatigue could include low hemoglobin, low iron, mental fatigue, lack of sleep, or other physical changes. Shortness of breath can be caused by too much or too little fluid in your body, low hemoglobin, asthma, COPD, or other lung problems. People may experience different issues based on their biological makeup. Less desire for sex, painful intercourse, changes in menstrual cycles, difficulty ejaculating, difficulty getting or keeping an erection.
It was hard to be intimate because I wasn't up for it. I had no libido.
Impotence is the inability to get or maintain an erection. Why these changes can happen include physical causes, hormone imbalances, blood vessel damage, decreased sensation, medication side effects, both legal and illegal drugs, life changes, depression, and stress.
I'm not as sexually active as I once was, but I'm still active.
Life is hard. Life with chronic illness is harder. You are not alone. Talk to someone about it. It could be family, friends, your PD team, or a counselor. Ask for help. No one will judge you or think less of you if you ask us for help. There is help out there for many of the issues mentioned if you ask for it. Many psychological factors such as anger, worry, fear, guilt, or anxiety can also affect intimacy and sexuality between partners. For example, some people are self-conscious about scars or catheters, which may affect how confident, sexy, or desirable they feel. In addition, partners of someone with kidney disease may be worried about physically hurting their loved one when engaging in sex or intimate interactions. It may be valuable to have your partner speak to someone about their concerns as well, such as a counselor. Not everyone will experience these changes, or to the same extent. If some aspect of kidney disease or treatment is impairing your ability to be intimate with a partner, you can consult your doctor or other members of your care team about ways to stay sexually active and/or intimate.
I was depressed in the beginning, but was able to work things through by talking with my wife. We've been together for 65 years.
Frequently asked questions. Can I have sex while on PD? Yes. There are many different tips that can make you safe and comfortable during sex or intimacy. Securing your catheter well is important to avoid the catheter being pulled and causing trauma to the exit site. You can do this by using your dressings, tape, a PD belt, a stabilization device, or some other creative way that does not involve sharp objects such as safety pins. You could even use fitted clothing or lingerie to double as securement. If you do end up irritating your site and are concerned about it, contact your PD team.
At first, all I could focus on was my tube. My partner suggested I wear a t-shirt, and now I'm not worried about it being pulled.
My partner, I've had to reassure him that I'm okay. You're not hurting me. Keep going. Having the conversations, it has made us more intimate as we express things a bit more.
People may not want to be intimate while attached to the cycler for various reasons. If the issue is feeling too full and uncomfortable during intimacy, the PD team can help to figure out a plan that works best for you. You may need to consider timing or coming up with a plan with your PD team. Your team may suggest disconnection, manual exchange, or other options. Are there any sexual positions that are better or worse for a PD patient? Any position that does not cause your PD catheter to be pulled or damaged is best. Try to avoid too much rubbing on the exit site, as this can lead to redness, irritation, or even infection. Different positions will be better or worse for people based on their other injuries, illnesses, or just preferences. You may have to try various positions to find what works for you. These may be different than what you have done in the past, but have fun trying something new. Communicating with your partner is essential in any intimate relationship. It is especially important to communicate with your partner if you are experiencing feelings of fear, anxiety, guilt, or other negative emotions. Often communication can help ease these feelings and identify solutions. Having to do PD is not the end of your intimate life. It may look different than before, but there are ways to enjoy yourself and your partner. Ask for help if needed, and have a conversation with your partner or your team. Be open to change and give it a try.